and gentlemen, this is your host, Dr. Aftab Ahmed, with the program Innovative Pakistan with Dr. Aftab. And today is a very special day, that is World Hepatitis Day. And it's very special in Pakistani perspective because Pakistan, unfortunately, has the highest population of hepatitis patients in the world. That's why there is a much need that we should raise awareness about hepatitis in Pakistan. And to raise awareness, we are really lucky to have Dr. Anum Abbas with us. She is gastroenterologist serving in Holy Family Hospital in Rawalpindi, and she is actually being like an expert. We are very thankful to her for joining us today in the studio, so we can talk in detail about hepatitis, how we can raise the awareness, what are the preventive measures, and also how we can eliminate hepatitis from Pakistan. So, as per the format of program, we normally start with the guest journey. So let's talk about the educational journey of Dr. Anum Abbas, and then we'll go to her professional journey, and then we'll talk about the main topic of today's discussion.
Assalamu alaikum. I'm Dr. Anam. Thank you, Dr. Aftab, for calling me here. Um, Regarding gastroenterology, as you know, it's a very vast field, and most importantly, at the moment, many females are in this field. That's a good thing because there are patients who doesn't want to come to hospital because they're female and they have issues,
Right.
and that will help. Regarding my educational journey, I have done my matriculation from Sadiq Public School, which is located at 6 Road. Then I did my FCPS from FSC from Fuji Foundation Girls College.
Right.
My medical journey starts with Rawalpindi Medical College, and I'm privileged that I'm currently working there as senior registrar.
Excellent.
I didn't have much breaks in my educational journey. I have Initially I have liking for human body, human physiology, how it works, what happens, how doctor diagnosed a condition, how just by telling a symptom he or she can tell that you're having this problem.
Right.
So that intrigued me, and then I started my journey in Rawalpindi Medical University. Later on, I started my training from Shafa International Hospital,
Okay.
then moved to Military Hospital,
Mm-hmm.
and 2019 I did my FCPS, which is consultant. I'm now consultant gastroenterologist.
Right.
Other than that, because my interest in medicine as well, I have done MRCP UK,
Excellent.
and for the last 6 years, I'm serving as consultant gastroenterologist.
Excellent. So you have like excellent journey starting in Rawalpindi, then graduating in medical in from the Rawalpindi Medical College, and then now serving in the same university. So that's I think an excellent journey that you have, and beside that you have like specialization from UK as well. So this is the your journey. So now I think we also like started with late. So
Yeah.
let's talk straightly to the topic. So as we started the discussion, and I mentioned that Pakistan is unfortunately having the highest burden of hepatitis in the world, especially the hepatitis C. The recent data says that there is a 7.5% prevalence. That's so very high in Pakistan. So, what do you think? Why there is a high prevalence of hepatitis in our country? What are the main reasons?
Okay, before answering that question, I would like to tell you about the slogan for this year's Hepatitis Day.
Mhm.
It's let's break it down,
Mhm.
which is basically there are many stigmatas attached with hepatitis, like it's transmit, like it's in the air, like it's transmit by touching or even eating in the same bowl, and sometimes the people just ask you stop eating meat, you have hepatitis.
Right.
There's so many myths, misbeliefs regarding this condition that affects the people, and secondly it is stigmatized. People don't come forward, don't report they have this condition, which lead to development of this condition in their families.
Right.
If a male person has or even a female person has, that can lead to spread of that condition in their family.
Right.
So that's the main reason. Initially we were back at the list, like we are fourth and fifth level, and now we've progressed to the second level worldwide. So which is an alarming feature, and that need to be stopped. And
Right.
we need to break it down that hepatitis is nothing which can't be cured. It has treatment, like it malaria has treatment, typhoid has treatment, hepatitis B and C has treatment, and that can be stopped with proper treatment.
Right. So it's very important. So the slogan is let's break it down. So that's also very important. And the slogan says that if you need any information, if you need to know anything about hepatitis, definitely you can ask. And the doctor and the clinicians and the public health expert, they will explain it fully so you can have a proper understanding. So we were having the discussion in Pakistan, and unfortunately, you are from the healthcare sector, and the data says that the main reason of spread of hepatitis in Pakistan, number one is unsafe blood transfusion, and number two is the use of syringes, the multiple use of syringes in patients, and number three is the unhygienic equipment or instrument that's are being used. So the three leading cause in Pakistan are related to the healthcare setting. So and then we go beyond like the barbers, the saloons, and the intravenous drug users. So they are like
Yeah,
other.
that's right.
So how like of how we can improve the situation in our country. So
Basically,
what awareness is needed among the
basically
patients?
what happens, we have hospitals which have very much safe practice because we have quality insurance assurance in the hospitals. We
Right.
regularly check our instruments, we have regularly disinfection techniques, but whenever a patient has some pain, we have low tolerance for like medication which directly said give us IV injections.
Right.
And if you get an IV from a far flung area, you're not sure whether the syringe is new, whether it has been, or any instrument, like any procedure done, like you have some cut on your wrist on somewhere and also the body, and you want it stretched or clean. You go to a place, you are not sure whether that place is authentic, whether this place is going a proper cleaning of the instruments, and like tooth extraction.
Right.
There are many clinics like you, if you go on a road, there are like 50, 60 clinics around the road.
Right.
And you're not sure whether they have an autoclave machine which is used for sterilization.
Right.
You can't totally blame on the healthcare. Like if you go to proper place which has all the measures to clean the instrument, to use safe syringes, then it's safe. So what we suggest don't go for IV injection, don't go for unnecessary procedures. And if it's required, then go to a place you know that it's known, like my hospital, Holy Family Hospital. In Pindi, Islamabad, there are multiple hospitals. Right. And they're very big names. And they have very clean environment. You can go there. If you find some private, you can go there. If you don't, government hospitals are the best for this purpose. Right. And we have the facilities, we are doing procedures, we are checking, even we are checking our instruments for any bacteria or viruses.
Right. So yes, that's very important. So even like going in detail of hepatitis. So there are hepatitis with different names. Some people say it's hepatitis A, sometimes say it's B, C, D, and so on, E. So for our audience, can you please briefly explain for them that what are these hepatitis? If somebody is having hepatitis A, what it means, what is mean of having hepatitis B, what is mean of having hepatitis C. So normally we talk more about hepatitis B and C. But what are other hepatitis?
Basically, there are multiple types.
Mhm.
Hepatitis A, B, C, D, and E.
Mhm.
For simple reasons, what we can tell is mode of transmission, how it spreads from one person, whether it's spread from person to person from blood. Hepatitis B, C, and D are important because they spread by blood, right, body fluids. Like if you have some injections, if you have some sexual contacts, you are going for barber for some shaving, right, you are using some nail cutter. While hepatitis A and E, they mostly transmit by oral route. Right. Like the water you drink, if it's contaminated, it's a source of infection. The food you eat, if it is contaminated, this person who is cooking the food for you has not cleaned his hands while cooking. If there is no proper hygiene, that can lead to spread of A and E. And A and E are mostly acute infections, like they happen and they will spontaneously clear itself from the body, like over six weeks.
Okay.
But in pregnancy, E is a bit complicated. Right. While D and C, they transmit by blood. And what we need to know is that we need to stop transfusions, we need to have safe sexual contacts, we need to use our own blades for shaving, we need to have our own nail cutters at home and teeth brush. Right. But it won't spread by eating in the same plate while wearing someone else's clothes. There's nothing like that.
Okay, so initially, I think that it's also very important that people should have an understanding that what are the hepatitis which are spread through like unhygienic practices, and other is like that is spread by the blood or body fluid. So they, yeah, should have an understanding. Another is like for hepatitis B and C, mostly people say that they don't have any symptoms. They like according to data, it says that it's like around 80% is remain asymptomatic. They don't show any symptoms. So people think that they are fine, they are eating fine, they are drinking fine, they don't have any conditions. So why they should go for testing? Why they should go for treatment? So what do you say for all those patients?
Basically, as we already told, most of our patients in OPD, they say we are not symptomatic, but once yeah, they are diagnosed with the condition, they say I have this symptoms, I have this symptoms.
Hmm.
That's most of the stress.
Right.
But we told them, if you have anyone at your home who has hepatitis B or C, it's very good that all the family members should get tested,
Right.
because the chances they might have spread. If the mother has hepatitis B or C, it's very important that all her children should get tested.
Right.
All the babies born to a mother who is hepatitis B should have hepatitis B vaccination
Hmm.
to prevent the spread of infection. Whether the mother is B positive or not, all the children should have B vaccination, because B is a preventable condition.
Right.
Even if I'm at my age, I need to go for vaccination.
Right.
Each and everyone has to get vaccinated to prevent the spread of B.
Hmm.
In case of C, there is no as such vaccination, but it's very good as we are getting on the top of the list in case of hepatitis B and so C. So government is providing free testing for B and C in government hospitals.
Right.
We are providing free of cost medicines.
Hmm.
If medicine is free, why not take the treatment? Why not free yourself from an infection which could be life threatening later on, which can lead to multiple complications, which can lead to liver cancer at
Right.
later stage in life?
Hmm. So, like in case of that we are discussing about hepatitis B or C, for example, in both of the cases. So, if somebody is like feeling fine and he has to get some like job or he has to go abroad and he is tested for hepatitis, then he goes to the hospital. So normally they are like sometimes they don't disclose to the family and sometimes even they don't have symptoms, so they keep it for themselves. So what is your advice? Like if somebody is asymptomatic, and then what the person should do?
The person is asymptomatic, he or she need to get the treatment.
Okay.
That's the first and the final thing. Other than
Mhm.
that, they should tell their family,
Okay.
because it will help prevent the spread of infection.
Hmm.
If someone has hepatitis B or C, they need to use a separate nail cutter,
Okay.
toothbrush,
Hmm.
comb,
Right.
so that even their razors for shave, so
Hmm.
that it will prevent the spread. And in case if you have some accident later on in life or something like that, you need to go for urgent surgery. If your family know that you have this condition, they will inform the doctor.
Right.
And it's not always that we always get the test done B and C before any
Hmm.
surgeries.
Hmm.
But if the doctor is well informed, he will be sure that he need to wear gloves. The other staff members need to be very wear the glove, and they need to be very efficient that to prevent the spread of infection to themselves as well.
Right. So, talking about the awareness, first thing that I think is important for our community is to raise awareness. So, and as we were discussing initially, what are the like main causes of spread of these hepatitis? And one of the things for the healthcare sector, you have clearly mentioned that it's very important that the person shouldn't use the injections for the common conditions, and also like we should check that the equipment are sterilized or not. So beside that, um, how we can raise a massive awareness in our country? Because awareness is very important. We have the highest population, and the disease is spreading at a very fast rate. Because we know the surveys which were done like back in 2008, that was a national survey was done, and then in 2017. That was done in Punjab, and then in 2019 that was done in Sindh. So from that, we came to know that there is like the cases are being increased in our country, and for that there is a need of awareness. So at what level, being like a consultant and being an expert of the field, so what we should do, especially using like media like this, the Radio Pakistan or the television and other channels. So at what level we should like start awareing the people, and
um,
what kind of awareness campaign we should have?
we need to start from the basic level. Like,
Mhm.
we have multiple levels. We can use media. Okay,
Okay.
we have television, we
Mhm.
have Radio Pakistan.
Mhm.
Other than that, we have social medias,
Right.
Facebook, Insta, Snapchat. Other than that, we have mosques.
Mhm.
Everyone go to pray for prayers.
Right.
We can ask the Imam Masjid. We can educate him,
Mhm.
and he can educate the people. We can educate the teachers,
Right.
and they can educate their students. if a student learns about it, they will go and tell their parents.
Right.
In this way, we can start from different levels, and this will build a mass knowledge, mass awareness,
Right.
and this will help prevent. We need to give, even we need to publish some pamphlets, and we can just drop it by home. We ask, like newspaper,
Right.
we can add that in newspaper as well. This will help prevent. If a person reads, he will try to understand. If you see a thing once, you might ignore it.
Right.
But when you see it at multiple places, at multiple times, you will start thinking about whether what you believe or what they are saying is correct.
Right.
If one person says something, you might believe. But if three or four persons have the same opinion and you have the different opinion, then you might consider they might be wrong, or they might be right at this time, or you might be wrong at this time. So this will help.
So definitely, so there are so many ways, and definitely we should opt. And you have a very good message that we should like raise the awareness again and again, so the people they could get the information, they could get to know about the disease and how they can prevent it. Other thing is like the people are concerned about the treatment. So as you have mentioned, that government is providing the diagnostic as well as the treatment for free. So what is the current treatment for hepatitis B? And what is the current treatment for hepatitis C, how effective it is, how long it is. And like initially, if we go 15 years back, then there was a treatment. Interferon was a very common treatment, but there were so many side effects. So people are sometimes like those who are treated long ago, they used to tell their stories. Okay, uh, this is how they get the treatment. Their stomach was upset, their hair were gone, and so on. So these kind of complications. So what are the modern treatments and how effective they are? What are the side effects?
The good thing is all the treatments available in tablet forms.
Mhm.
You can easily take it. You can take it in your bag. You can anywhere you go, you take your treatment with you.
Right.
For hepatitis C, first we
Mhm.
talk about that. There are treatments. There are multiple treatment options available.
Mhm.
But in Pakistan, at the moment, the two options are available, which is swasthbivir and declatasivir, which is one combination. There are two tablets. You need to take them once daily for, depending upon your liver condition, either 3 months to 6 months. Mostly
Okay.
we give 6 months.
Mhm.
The other is valpetasavir and swasthbivir, which need to be given for at least 3 months to 6 months, depending if your condition liver has affected to some extent, and there are you have developed some complication over time, then you need 6 months. Otherwise, 3 months is fine, and the results are excellent.
Right.
Like 97 to 98%, there's complete cure.
Wow, that's so good.
And the good thing is you don't need to get your PCR, which is the test number PCR, done again and again. You can done it before treatment and after treatment.
Right.
Not every year, every 6 monthly, everything. If you have some condition where you need blood transfusion, like you have thalassemia or you're a dialysis patient, then you need to get it done regularly. Otherwise, once you have done, or in case you have some surgery later, like 3 to 5 years, or you feel like you have similar symptoms, then you can get it done. Regarding B, there is a single medicine which is in the form of tablet. It either tenofovir or entecavir, or other one is tenofovir.
Okay.
These are very good tablets. Single tablets is need to be taken daily, once daily, and they have minimum side effects. Uh, Regarding the treatment of hepatitis B, it depends upon some test values. Some
Okay.
people need to take treatment for lifelong, while others need to take it once their PCR is negative. They need to continue for some duration of time,
Okay.
and then we can consider stopping the treatment.
Okay, excellent. So the good thing is like we know there is a success story that was being done in Egypt. So they had the highest population of hepatitis, and then they started a program, and then now that country is hepatitis free. Now Pakistan also has. I'm sure you are aware about the initiative, the Prime Minister initiative for elimination of hepatitis from Pakistan, and that started from this year. But the challenges are huge in Pakistan. One of the challenges like uh, the fragmented healthcare system that we have. Unfortunately, that's not like up to the mark it should be, as we know about the challenges. The other is the huge population. So we have like population. If we have to screen the people of 12 years or older, then we have a population of around 170 million people that we have to screen, and then screening and then confirmation of screening through PCR and then the treatment. So how you can foresee about this initiative, and can we eliminate hepatitis till 2030?
Yeah, it's a very good initiative. Our target is by 2030 we need to eliminate hepatitis B and C from Pakistan. For that reason, a mass screening is required.
Right.
Even the WHO at the moment is saying if a person is has a test of ELISA test is positive for B,
Mhm.
he doesn't need to get the PCR done. He can be started directly on treatment for B,
Okay.
because they try to conserve the resources, and they know there are countries which are poor in resources like ours.
Mhm.
So we need to conserve the resources. We need to give the treatment to those who are positive. Even if someone doesn't has quantitative PCR, if they have qualitative PCR, we'll start the treatment.
Right.
And later on, we confirm it with quantitative one. We will just need one reading that say it's negative.
Mhm.
So it's really important. If we don't utilize our resources on this, there will be chances, there will be increase in liver cancer with the duration of time. Like in 2045 there might be massive rise in liver cancers,
Right.
because a huge population is affected with B and C.
Mhm.
And most of the time they are not taking treatment, and there are multiple complications which develop if the B and C prolong for a long duration. They might develop ascites, they might develop liver failure, they might have bleed from their esophagus. These are the conditions they need, and they are difficult to treat, and the ultimate treatment would be liver transplant.
Right.
So in
Okay.
order to prevent that cost, we
Mhm.
need to prevent at the level of B and C.
Okay, excellent. So what kind of like patient you are seeing in your practice? At what stages they are mostly either they are asymptomatic or with symptomatic? What kind of complication they have? And also please highlight that what kind of facilities you have in your hospital for the treatment.
Okay. First of all, in our hospital, we have the facility to screen the patients for B and C
Mhm.
and provide them with the treatment, which is hepatitis B and C clinic.
Okay.
And the good thing is government has not established this clinic only in the central areas of big hospitals. It's also established in BHUs, THQs, DHUs,
Wow.
so that this facility can be utilized by common people who are living far away from the big cities.
Right.
So we can screen, we can treat. Other than that, we have our gastroenterology clinic where we
Mhm.
see all the patients who have liver conditions.
Right.
In those clinics, most of the patients present when they have developed the condition, and they
Okay.
have either they are treated or they are treated very late, and they develop the liver complications like they develop ascites, which is fluid in their abdomen. They have some bleeding from their mouth due to the vessels. Other than that, they have some drowsiness due to this condition, which are all the complications of this condition. They came there for the treatment of these conditions. We optimize their management, and those who require transplant, we even do their workup for that
Mhm.
and transfer them to the appropriate facilities for the liver transplant.
Okay.
Other than that, one more clinic we are doing is, which basically I'm doing, is HCC surveillance clinic, which is liver cancer surveillance clinic. We are trying to prevent this liver cancer because how it's very simple how to prevent it. We need
Right.
to do an ultrasound every 6 months.
Okay.
If there is no such cancer lesion in the liver, that's fine. Then we repeat it every 6 months,
Mhm.
so we can diagnose that if any such condition develop, we diagnose it early and treat it appropriately to prevent any complications. We even start chemotherapy. We
Okay.
have then, if this is a screening clinic, and then there is other clinic which is HCC clinic, which is
Mhm.
liver cancer clinic.
Okay.
We are also giving treatment to those who have developed the liver cancer.
Mhm.
We have chemotherapies available,
Okay.
which we are providing to them, and it's mostly on Betul Mal or Zakat, so patient don't need to pay for them because they're a bit expensive drugs.
Right.
And these facilities, I think, are very helpful for, if government hospital is doing that, this is more than any hospital do. If
Excellent.
Because if you go for these services in some private institution, you have to pay a lot of money for that.
Right. So, as Dr. Anam, she has mentioned that there are excellent facilities in Holy Family Hospital. So they have different clinic. One is the gastroenterology clinic.
Clinic,
She has mentioned. So there is another clinic.
hepatitis clinic,
There's a hepatitis clinic and also the hepatitis.
surveillance, and
Yeah. So
cancer
so
clinic.
so all these things are available in Pakistan. She has also mentioned that you can also get tested and treatment either in BHUs,
DHUs,
yeah,
DHUs, THQs, like
at
district
tehsil
headquarters,
levels and
tehsil
yeah.
headquarters, they
So
have the facility, they have special allotted hepatitis clinic there.
wow. So all these things, as this is a real challenge for our country because we have, as we mentioned in the start, we have high prevalence of both hepatitis B and C, and especially hepatitis C in our country, and all kind of like diagnosis and treatment facilities are available at the sea level as well as district level, and also in the central hospital which are available in the big cities. So I think we shouldn't waste time and we should go to all these facilities. So this is the first step. If not, then the government has started this program in which they will do the massive screening in initially in the 50 districts. So all the people above the age of 12, they will be screened, and those who will be positive will get the treatment, and all these things are free of cost. So this is excellent initiative by the government, and we should avail this opportunity. So at the end, because our time is over, we'll definitely request Dr. Anum Abbas to join us some other day, and we'll talk in detail about what she is doing in the hospital and what kind of services are available under her leadership. So we'll definitely request us to join us once again. But for today's, it's very important that we should raise awareness at all the level, because if this is a challenge for our country, we should all work in integration. We should join hands. All the stakeholders should come together so we can prevent the spread of hepatitis in our country. Not only we can prevent the spread, but also those who are infected, they should also get the treatment. So with reference to the day, we'll request Dr. Nambas to please share her message with reference to World Hepatitis Day.
So, what we need to do is we need to break all these stigmas, misbeliefs regarding hepatitis B and C. We need to come forward. We need to care for ourselves, and we need to get tested and prevent the spread of this disease to our families.
So thank you very much once again,
Thank you.
Dr. Anum Abbas. This is the first day, working day after the weekend, so sparing time from the practice is always very hectic. So thank you very much for joining us in the studio, and we'll definitely request her once again, because these things, they need to be a lot more discussed, and
Yes.
that's why we'll request her again to join us in some other day, and we'll talk in detail about hepatitis and other gastroenterology related conditions. So thank you once
Thank
again.
you.